My name is Ted Burns, and I'm Senior Director of Political Affairs and RADPAC for the American College of Radiology Association, and I want to welcome you to our RADVOCACY podcast hosted by RADPAC. Our goal with the podcast is to give you a behind-the-scenes look into the various advocacy efforts of the college, our members, and insights from political influencers here in Washington, D.C. Today, I'm honored to have with us a guest who has one of the most interesting and accomplished backgrounds in radiology, as well as service to the country. Dr. Steve Ferrara, welcome to our RADVOCACY podcast. How you been?
Good. Thanks for having me, Ted. It's great to be here.
As many people know, you and I have gotten to know each other really well over the years, and we'll get into some of those experiences together, I'm sure, during this talk. But before we start, just as a reminder to those listening, kind of talk a little bit about your background with regard to where you did your training, subspecialty, things like that.
Sure. Yeah. So I grew up in Arizona, when I finished high school, I was eager to get out and see the world, which I think was a precursor to what I ended up doing professionally. So I was eager to go see the big bright lights in big city. So I went to UCLA, which is where I did my undergraduate. And then, when I was a senior in college and looking to go to med school and going through all my acceptances, that's when the first Gulf War broke out in January of 1991. And I hadn't really envisioned the military as a career for myself by any means, but, I was caught up in this surge of patriotism, like I think a lot of people in the country, and it gave me that opportunity to reflect on my family's background. My grandfather came over as an immigrant, and then without any school, he was a stowaway on a ship when he was 8 years old from Italy. And then my dad got drafted right out of high school and got drafted to go to the Korean War, which gave him the GI Bill, and then allowed him to go to college and then on to law school. So I thought, hey, if I'm going to be doing trauma-related specialty, I should do it in the military and help people like my dad. So the best way I knew how to join the military was to go to the military's medical school, which is like the service academy for med school, called Uniformed Services University here in Bethesda, Maryland, which is around the campus of Walter Reed. So I went to med school there, took a commission in the Navy. I was living in California and said the Navy seemed like a good idea. I'd be getting to live by the water. And so that's why I chose Navy. And then I went on to USIS. And then from there, I did a surgery internship in San Diego at the Navy hospital there. And again, the Navy's a little bit unique because they send you out. So then I went to the Marines for a couple of years after internship to be a general medical officer. And it was during that time that I had this opportunity to reflect, kind of get off the treadmill of med school and internship, and realize that interventional radiologists did everything that I wanted to do. They, took care of complex patients, did procedures all day, were hospital-based physicians, and I thought, and I, had finally had some exposure to them as an intern. So I changed, and instead of becoming a surgery resident, I said I wanted to do radiology. So I went back and did a radiology residency in San Diego. Went on, did interventional radiology at UCSD, and then after that, I did pediatric interventional radiology out at Boston Children's Hospital.
And a little bit different than the traditional path, but that's actually what makes your story unique and really so appealing, I think, to so many of the people who you've gotten to know over the years within our radiology community. So you and I came together, I guess it was probably 2016-ish, give or take. And we kind of have a funny story that for years we've talked about. Was it 2012? Okay.
2012 at Brugger's Bagels on East Street.
That's right. So I remember you randomly contacted me and said, hey, can we meet? And I was like, who's this guy? I don't even know what this is about, but right. We'll go share a bagel. And we're sitting there by the end of the conversation with these little small napkins. It's kind of like the stories you hear in movies, like scripting out. If you were to run for Congress, how would this work? And we created a great friendship starting there all the way through the last several years. And I think so many of our folks, when they hear your name, they remember your run for Congress in 2018. You ran I'm biased, but you ran an excellent campaign in a very challenging district, in a very challenging political environment. You had a very impressive win in your primary, lost the competitive race in the general election to the individual who's still the member of Congress in the House from that area. But can you kind of fill the gap between that moment, 2018, 2019, after your race, and kind of leading up to where you are now? We'll get into what you're doing now, and I think that's really going to be of interest to a lot of our listeners. But kind of that 5-6 year gap of things that you're doing, to the extent that you can, disclose it. I don't know how much of it is public or not, but if you could, that'd be great.
No, sure. I'd be lying to say that, you put a lot into running, for public office. And that was, when you do that, you do it to win. So it's disappointing in November. I was always proud that, my name was on a federal ballot in November, which, I look at that as being in a long line of people I've always admired. I'm a big history buff, but nevertheless, pretty disappointed to not be doing the job I was hoping to do. So I had to refine my footing. So, okay, well, if I'm not going to be in Congress, what am I going to do? And so I came back, and, Elizabeth and the kids, she was active duty then. She's still active duty Navy now. So they had stayed here and, continuing working at Walter Reed. So I came back to DC, and I spent a little time in private practice kind of as a placeholder, knowing that I really wanted to get back into government and into policy somehow, which has really been my passion for a long time. And so, within about a year or so, I started working at Defense Health Agency, which is, again, a very small world because that's in my portfolio now. And so I worked at the Defense Health Agency doing clinical operations for the National Capital Region. And, kind of concurrently while I was doing that, one of the things I had been reached out to do was to go actually work at the CIA, which I wanted to stay in the national security apparatus. One of the things I liked so much about my time in the military was I really liked the overseas mission. I liked the deployed mission. That was one of the things I missed about being out of uniform. So I had applied to the CIA. And interestingly, it takes a really long time. So, and you won't be surprised to know it's a very cryptic process. And so it actually took a couple of years for that process to go through. But then I get a call the way they do, get a call out of the blue from a block number and says, hey, you want to push you through the process. So I can't talk about a lot about the process, but there's a process. Clearances and so forth and medical stuff. So I go ahead and do all that. And then, so I actually then started working at the CIA, and I applied there. It's, again, you don't know exactly what you're going to, applying to be a, physician at the CIA. And then, once I was on board, they asked if I would become the chief medical officer. They'd known I had done that in the Navy. I'd been the Navy's chief medical officer before retirement. So they asked if I would do that. So a senior intelligence service officer position. And so that was obviously a great opportunity. So I took that and jumped at the chance to do that. So I spent that time being CMO of the CIA. And throughout all this period, I always continued to do interventional radiology. So I've remained clinically active throughout my whole career in all these different roles. And so then fast forward to more recently, I was still working at Walter Reed, still doing clinical work. And after the November election, there was knew there was going to be, Republican administration. So I was excited to hopefully be considered for this position, here, at the Pentagon. And I was, because I've always, the military health system has been really the defining organization of my life. I joined it in 1991 before it was called the military health system because it was just the Navy, the Army, and the Air Force. It wasn't really as consolidated. But it's been a part of me the whole time. And so then, I got tagged to go down to West Palm Beach and interview, and just a little before Christmas. And I, got offered this position, and here I am.
So you're really teasing this position. So let's get into that. So sure. What is your official title? Because if I try to say it, I'll probably botch it. So give me the official long title, and then tell us what it really means, kind of what your vision is for the position, your role, your goals, and kind of how it applies to radiology, and maybe just healthcare in general. Although I think the title will probably be indicative of that. But if you could.
Sure. So I'm the acting Assistant Secretary of Defense for Health Affairs. So that's the Chief Medical Advisor, Principal Medical Advisor to the Secretary of Defense, and the Undersecretary of Defense for Personnel and Readiness. So that's kind of the next two rungs up, and then obviously on to the President. So we're a $61 billion healthcare system, take care of 9.5 million people. And the ASDHA, which is easier to say than to give that whole big long title, is effectively the chief executive officer of this big global complex healthcare system. So I mentioned the Defense Health Agency before. So the DHA has currently about 115,000 folks. So that reports to the ASDHA. The Uniformed Services University, ironically, my alma mater, reports to is another direct report to the ASDHA. And then there's several other kind of smaller things, but includes the whole research and development. We have a multi-billion-dollar research and development portfolio of things that you can imagine. We do mostly research and development related to things to improve survivability of warfighters. So as you probably know, and many people probably know, a lot of the big advances in healthcare over the last really centuries, but specifically even in U.S. history, have been during warfare. Anything from blood transfusions to ventilated medicine to air medevac to, in the most recent wars, things like prosthetics for amputee care, traumatic brain injury, and brain health. So we do a lot of research on those things, vaccines, public health. So in this role, as I mentioned, I basically advise the Secretary of Defense on health policy, both as it relates to the delivery of care. We have about 700 facilities around the world, hospitals and clinics. So all those roll up and report to this office. So I talk to the Secretary on basically to make sure we talk about two things, that we have a medically ready force, which means that our warfighters are all ready if we had to go into war tomorrow, that everybody's ready to go. They have the medical readiness. They're fit to fight. They're healthy. They've got everything they need to be able to go prosecute war on behalf of our national security. And then we need a ready medical force, which means all of our healthcare providers in the Army, Navy, Air Force are well trained. So we do force generation, meaning all the way from med school or enlisted people, teaching them how to be a healthcare professional, to then being in all those 700 places where they sustain their skills. We do graduate medical education. We have thousands of people in graduate medical education at any given time. And then obviously we go to war. We do, really during the pandemic, about 30,000 military personnel supported the country in doing COVID care at civilian hospitals. You probably remember, when I was active duty, not only did I go to Afghanistan, but I went to Banda Aceh during the tsunami in 2005. I know we had talked about that. And so the military does all kinds of those things. So we're always ready to do all those various missions. And so I help make sure we're always ready to do all those things. And you mentioned, how does radiology help? Well, I think in all these roles, I remember kind of one of the first big roles, kind of comprehensive roles in medicine that I had was when I was the Navy's chief medical officer. And some people thought, boy, that's odd to have a radiologist as the chief medical officer of the Navy. And I think what I always thought, it made really good sense because radiologists are doctors. So we really touch all specialties. There are almost no specialties that we don't interact with. So I think we're actually really well positioned to be in these kind of roles because we understand the surgeon, what the surgical folks are doing. We understand the medical folks, pediatrics, neonatologists, geriatricians, everybody. And we're also very good at systems-based. We're systems-based physicians, which really matters in an organization that's large and complex because that's really the way you have to manage it is you have to think of things in terms of systems. And then, I'd say I cut my policy teeth in the college. It was right after that tsunami, when I was out on the ship doing the tsunami relief, that was a sort of all of government approach. Not only were we doing it as DoD, there was State Department out there. There was, all kinds of, other folks from other branches of government. And that's what really made me interested in sort of how the U.S. government works. So that was my first exposure to it. And so that's how I wanted to get more involved in organized medicine and policymaking. And that's where I became active in the American College of Radiology. And it was during those early meetings where I was just, a youngster, like a worker bee, going, sitting through those ACMLCs, and, at the Washington Hilton, and kind of learning parliamentary procedure, hearing how people talked about, a lot of it was related to either standards and quality or reimbursement, and you'd hear about CMS, and folks like you would talk about your interactions with Congress and policy making, and it just really sort of, that's how I kind of started to learn about all those things, and then that just kept being cultivated, and it's why obviously I was working on Capitol Hill as a Robert Wood Johnson Fellow, was what I was doing that to kind of dip my toe in the pool to see what Congress would be like and if I would like it, as I was kind of thinking, would I want to stay in public service in that kind of a capacity? And that's how we met. But that was a big explosion, obviously, of policy experience. And I'd say I use that all the time now. In this role, one of my primary roles is going down to Capitol Hill. So I go to Capitol Hill probably a couple times a month, and I meet with, House Armed Services Committee, Senate Armed Services Committee, and I represent the military health system. And as I mentioned, $61 billion. We're about 8% of the whole DoD budget. So we're a sizable part of the top line budget of the Department of Defense. And so Congress, obviously, and then, also the appropriators, HACD and SACD. So meet with all those folks, and they're my board of directors. So if I'm the CEO, those 535 people are the ones that are keeping me, holding me accountable, that I spend that money well, that I take good care of those patients, that if we go to war, that we can promise, keep good on the promises that we make, to the people who raise their right hand, the sons and daughters of America that go into harm's way, and their parents, that they'll have the best chance to have a good outcome, should, God forbid, they become ill or injured, that we have, highly trained, highly skilled medical folks to take care of them anywhere in the world.
And I'll say a couple of things. So one, every time I feel like I'm busy, I'll think back to this conversation and be like, I've got more time than Dr. Ferrara. That's first and foremost. I think two, and you want to talk about silver linings. And obviously, I remember we were together election night, and we were obviously very, kind of bummed and disappointed. I remember the hotel we were at. I remember the room we were in. I remember we were talking, and you think back to that time, and you thought, man, the good, the impact you would have had if you had gotten elected and all that. And then you kind of fast forward to where you are now, and I'm like, you know what? Like, you may say those 535 or your quote unquote boss, if you will, but I would tend to argue that the impact that you are going to be having is probably even greater than if you were one of 535, in my opinion. And so, things have a funny way of working out. And so, sometimes, it's like, careful what you ask for. If you run for office, you may lose, because that's kind of part of it. But at the same time, I think that experience has really kind of done you pretty well to prepare you for what you're doing now and the impact that you can have. The last thing that comes to mind, and we talk about this a lot, is the doctor's doctor. And it's funny, like, there's so many different ways that, you kind of mentioned it as far as the role of radiology in the delivery of the healthcare system and how important radiology is, often overlooked. It's not as sexy. Not a lot of people know they're radiologists, but at the same time, they touch every part of it. And so, we are constantly telling members of Congress, congressional staff about that. It's great. Yeah, we need more family physicians, but guess what? They refer patients, and where do they refer them to? A lot of time to get imaging done, right? And other specialists do the same thing. And so, you clearly have a good understanding of that, and that's a good thing for for the country based off your position that you're in. So you had mentioned the Energy and Commerce Committee and kind of how you kind of dipped your toe in, and I kind of want to just briefly have you talk about that, only because I feel like, and you were at one point in your career when you were more probably clinical before getting into the advocacy bug, if you will, and especially now. I mean, our clinicians are super busy. They're almost overwhelmed with the volume that they're facing and trying to go through, all the different work they need to get done for the day. And advocacy can be a little bit overwhelming. It can be a little intimidating. What's the return of my own time and of investment if I do this when I don't have a huge bandwidth as it is? Am I really going to make a difference if I get involved in any advocacy, whether it's a call to action, whether it's going to the Hill, whatever it may be, hosting a fundraising event for a member of Congress or whatever? Like, can you, having been in that space on Capitol Hill, and even now kind of going, in front of members of Congress and talking about the stuff that you're doing, like, just and kind of getting over that initial, like, ooh, do I know what I'm doing? Do I have the right information? Like that kind of fear, hesitancy that a lot of our folks have, and almost kind of reassuring them, like, hey, there's value here and you can do it. You're a smart person. You're in radiology. If you can figure that out, you can figure out the advocacy part. Can you just kind of touch on that?
And the advocacy the importance of it can't be overstated. And advocacy is, what you're really speaking on behalf of. The way I always looked at it when I was, whether I was doing advocacy on behalf of men's culture radiology or whether I was, on the other side, or, when I told you I go down to the Hill a couple times a month now, I'm an advocate. I'm advocating for the military health system. I mean, that's what I do all the time. And one of the key pieces of advocacy because sometimes people think, oh, maybe it's, it's kind of sleazy or like a lobbyist or something. And what you really have to see yourself as is an educator. Mm-hmm. Those members of Congress are so busy. There are so many issues that they are trying to manage and try to get smart on that a lot of times, as you know, but people that might be new to the area don't realize it. In the area of advocacy is often you're talking to the staff members, the PSMs, as we call them, professional staff members. So the PSMs are who you're going to interact with by far the most, a little bit with the members. But they're the ones that are kind of formulating the policy and advising their bosses. And, if you don't tell them, someone else will. And think of, and again, I mentioned before, I'm a big history guy. So you go back, you read the Federalist Papers, and, Madison did a great job talking about factions and how people have to tell both sides. And that's why we have an open society, because that's how things are going to get sorted out. And that's how elected officials are going to get the answer, because people on one side of the issue and there's going to be people on the other side of the issue, and they're going to inform their, elected officials of the issues, and that's how they'll know. And that's what advocates do. And that's what radiologists, can do to talk about the value we bring to patients. Imaging is so important. I mean, it's, when I was a surgery intern, I mentioned before, we used to say that, the rule of thumb, the metric was 20 to 25% of appendices you took out were supposed to be normal, because that's how hard it was to do a clinical exam. Now, because everybody gets a CAT scan, the answer should probably be almost zero. And so there you're saving all those unnecessary surgeries that people were having because of CT. And, I used to talk about that a lot and say, look at the value. So sure, you might have to, pay for the CT scan, but look at what it's doing for the patient, what it's doing like for the healthcare system writ large. So, those kind of examples and those kind of anecdotes, I think, are really important. And most of our folks, we went into this field because we care about patients, and you're there on their behalf because you're trying to preserve their access to important diagnostic, or I'm an intervention radiologist, so the diagnostic and or therapeutic services. And if Congress, out of, well-intentioned as they are, they're dealing with constrained resources, highly filtered or maybe not always accurate information, if they don't make good decisions, then that can negatively affect a patient's ability, to get the right study, to see the right doctor, to get the right treatment. And so that's really what you're advocating for. And nobody can do that better than somebody who does it all every day. So I think it's vitally important. No lobbyist, no offense, Ted, but no lobbyist can speak to the value of what the radiologist is doing as well as a radiologist can.
So I'll say zero offense taken, because I've said that before so many times to radiologists, and I'm not ever in a reading room really reading. I'm not doing
a dark room.
Right. I'm not doing procedures, right? And so the case studies that a radiologist can come to the Hill and describe, and the impact that can have. Yeah, as a lobbyist, we can kind of summarize it and do 30,000 foot, but radiologists can come in and really use real life examples and real world examples and examples in the community where those, House members and senators represent. So really quickly before we finish up, because again, I want to be respectful of your time. So if you could give like one tip or piece of advice for, all the radiologists who are listening to this, and those in the radiology space, as far as how to get involved or what to do or whatever, what would be, from your experience, like just something that you feel could be a really good starting point for them?
First of all, I think involvement, the ACR is a great, hopefully everybody listening to this is already a member, that's how they're listening to this, but be involved with the ACR. I think you learn a lot. You can be involved at various levels of your what time and comfort allow, and in different areas. You can be more policy based. You can be more kind of clinically based. I think being involved at your hospital is really important. Always having a seat at the table. Again, we're talking about how can a radiologist be in this kind of role, looking out over the whole comprehensive healthcare system, because we understand so much about the way healthcare is delivered. And so there's lots of opportunities at your hospital. You really can show the value you have at your hospital. And so that's another great way. In general, I typically tell people to just say yes to things.
Yep.
That is really that's always been sort of my mantra. And because, as you talked about earlier, life is a funny path. And you can think one thing, when one door closes, a window opens. But if you're not in the game, if you don't have your pads on, that's the only time you're not gonna get a touch, right? But if you're in there and you're suited up, then good things can happen.
This is kind of crazy. Like, it's one of those things where you kind of have like your best friend from high school, and you don't see them for 10 years, 20 years. You see him at a 25th year class reunion or something, and then you pick up where you left off. And in talking with you today, and regrettably, it's more on my end that we haven't caught up as recently as like we would have liked. But as we're talking and I'm hearing you say stuff, I sit there and say, darn, I use so many references that Dr. Ferrara does all the time. Like, I've said so many times to people, like, just say yes. Just say yes. And it's like, that's where I got it from. I got it from you. I remember you always telling me that. So we're going to end here with kind of a lightning round of questions. This is kind of a lighter, fun kind of end to the podcast. And it gives a little bit of a snapshot into you as a person. We try to make this pretty quick answers, but sometimes I have to jump in and say something if I feel like if the answer's not right, even though it's your right to be right on these things. But I also know a lot of our guests, and sometimes I'm like, no, that's not. I know you. That's not correct. But all right, so let's give this a shot and see how it goes. Favorite food? And
MRE.
And
what is it? MRE, meal ready to eat.
Oh, got it. Of course.
But I have to say that. It's actually Mediterranean food. I had to grab the party line.
Favorite place to travel?
Anywhere I haven't been before, or preferably somewhere that I can learn something.
Okay. And, favorite hobby? And I have something to say about this because I don't think you're going to say the answer I wish you would say, but go ahead. Favorite hobby?
I was going to say reading economics or U.S. history.
Okay. So I know that's true because I know you and I know that you're constantly reading all the time. The one thing that I wish you would say, because I don't think anyone really realizes this about you, and maybe it's not as much a recent thing as it was during, when you're younger, but people don't realize you are a heck of a golfer. I mean, you are a really, really accomplished golfer as a younger gentleman, and you probably just don't have the time and bandwidth and to do it anymore. But I was kind of hoping that you would sneak that in, but I know that you are a big reader. So
former golf.
Favorite saying? I know you've got so many. Now this could be something that that's kind of a famous quote, and I know you have a lot of famous quotes and things that you like to reference, or it could just be something that you say with your kids, or something you say in your house that's kind of a little quirky, or something that's unique that you use a lot. Favorite saying?
Well, I have to say, just say yes. But I'll tell you, since you said, I'll give you a second one if you give me the grace. And I got this from my dad. It's de gustibus, which is which means like one's taste. So when you're having a debate, it's like, lad, I was sitting around my kitchen table, so now my kids even say it. If you disagree, you go de gustibus.
Okay.
Which means de gustibus non est disputandum is the full Latin phrase. That was, you wonder why I'm the way I am. That's
well, and I met your dad, who was a great individual, funny guy, and I know you get a lot from him in very good ways. So, hey, look, I want to be respectful of your time, so I'm going to cut this now. But man, it's good to connect with you. I appreciate all that you've done. I appreciate all that you're doing and will do, not just for radiology and not just for healthcare, but for the country at large. I wish we could clone you, but I don't know if that's something that we're allowed to do. But
you might be the only one that wants to do that.
But I appreciate your time and everything, your friendship, and look forward to catching up with you real soon. Thank you.
All right. Thanks, Ted. Take care.